Welcome back to the Healthy Chicago podcast, where local health professionals and their guests discuss the latest public health issues affecting Chicagoans.
Welcome to Healthy Chicago. Thanks for being here. We are excited today to address a really important topic about suicide. And I would like to introduce myself. I'm Kathy Calderon. I'm the Director of Mental Health Operations at CDPH in the Behavioral Health Bureau, the Office of Mental Health, and I use she, her pronouns. And I'm excited to introduce Tynisha.
Hi everyone, my name is Tynisha George. I'm a coordinating planner in the Office of Community Planning and Equity Zones.
Thank you.
Hi everyone. My name is Colleen Lilly. I use she, her pronouns, and I am a public health administrator too with the Laboratory-Based Surveillance and Disease Control Bureau.
So today I just want to start off by saying we'll be talking about suicide, which can be a difficult topic to explore, and so want to invite the audience to really take care of yourselves as you listen to this discussion, and please take time if you need to stretch or to get support, as well as we do have the 988 National Suicide Lifeline that you can chat or call in the event that you need additional support. And so I will start by just giving a rundown of the initiative and sort of the summary of it. So we started this initiative to really address the issue of suicide in the city of Chicago. As the health department, we can take a population's approach to addressing suicide, and we see that there are suicide disparities across the city's communities and populations. And during the pandemic, we saw spikes and an uptick in suicide rates across the board, but especially impacting those who were disproportionately impacted by the pandemic. And so we really wanted to take the opportunity to build community, generate dialogue around suicide and suicide prevention, as well as get as many supports out as possible to help people get support who may be struggling with suicide. And so we launched the initiative on May 1st of this year in honor of Mental Health Awareness Month. And one of the primary mechanisms for what we are providing to the community, as well as building community within the health department, is that we are going to provide free question, persuade, and refer trainings, what we'll be considering QPR throughout this. And so this is an evidence-based training that allows everyday people to learn and train on the warning signs of suicide, help talk about suicide with someone who might be experiencing thoughts, as well as get them to the support they need. And so a really beautiful thing happened as we started this initiative last fall. We get a lot of questions from the community, what resources are out there around suicide, and we are aware that we can provide training and free training at the health department. So we wanted to build that capacity. So we put out the opportunity across the department and got a really big response from across disciplines and people who've been with us as public health professionals for many years. And so we have a cohort of 55 people who do different work across the bureaus. And I'm excited to hear from Tynisha and Colleen about why they were interested in joining and being a part of this, because they became a certified QPR instructor to help communities and get this training out there. So I can start with you to talk about why you were interested.
So I joined as a QPR instructor, knowing that suicide is a sensitive topic. It's a very important topic, and it is not discussed enough. And being a Black woman, I wanted to be a part and also apply myself where I see is necessary, and this subject needs to come to surface more than what it is talked about now. And I've already learned so much. We had a training today, and I feel that our cohort did amazing, and we received some positive feedback as well.
Great, thank you. It sounds like it was really of interest to you to get involved, so I'm glad you did.
Yes.
Tynisha?
Well, thank you, Kathy, for bringing that to us at CDPH, to be able to have this type of training where we're all in different communities so that we can have an impact on the communities that we live in and also the communities that we serve. So I became a QPR, as they call gatekeeper or instructor. I already have a background in mental health, and I wanted to be able to enhance that in many ways, because in the Black community, talking about mental health is something is just hushed. It's stigmatized. Even the aspect in this sense of suicide is considered to be taboo. And it's very important for us to be able to talk about that more, with amongst Black women, especially amongst Black men, because sometimes there's that hyper masculinity, whereas like if you are talking about those certain things, then you're seen as weak, and you're not weak, you're actually stronger than you think, because you're bringing that to the surface and you're trying to have that type of conversation.
So really building on the skill set you come and the passion that you have for supporting your community.
Absolutely.
Yeah, that's great. And before I continue on this conversation, I just want to provide a quick disclaimer that suicide is a difficult topic, and so we always encourage a community of care around it for each other as we're learning, but also for you as listeners, we want to make sure that you know there are resources out there immediate that you can access. So if at any point you need to take a step away to take care of yourself during this conversation, we really appreciate and encourage you to do so. We also have the 988 Suicide Lifeline, which is available 24/7 through chat, calling, or texting on the website or the number. So please feel free to reach out if you need to. We'll talk about referrals a little bit later in this conversation. I think each person who became a QPR instructor is now serving as a gatekeeper as well as an instructor. So to distinguish a gatekeeper, that is someone who has more knowledge and training around how to recognize warning signs, how to intervene. And this is to build a skill set for anyone in the community. It's not, you don't have to have mental health specialty to be able to learn these skills. And I think sometimes there's a fear around getting involved or approaching a conversation about suicide, feeling like you're not qualified enough. So I'm curious to hear what types of skills have you learned through the QPR training, and what do you think it will provide to those who take the trainings?
Do you want to start?
You can start.
Okay. Being able to enhance those skills that skill set I already have with mental health, but being able to use this training so that it's tailored more. So it's not just textbook, that we're able to get the feedback from the community, because the communities that we serve, they know what's best for them. We don't want to come in here with, as they call it, like a white savior complex and trying to tell people like, this is what you need, this is how it's going to be. And more so of using like that power sharing and that power building and co-designing this particular training for the communities that we serve, I think is something that I've learned along the way that is extremely helpful, because that helps us be able to build more of that rapport with our community, and then empowering our community to be able to take these conversations and knowing that they're no longer stigmatized, that we no longer have to be it no longer has to be taboo, where people can be those social change agents in their community, where folks feel like I don't have to do this alone, that I can turn to somebody, or where someone sees something and can actually speak up and say something along the lines of seeing like those warning cues or warning signs of suicide.
So really building people's confidence level and learning about this and being able to use it in everyday life. Yes,
for the folks that feel hopeless, that they know that there's other people in the community that that no longer feel helpless to help you.
Because part of the training we've learned that during the days before a suicide attempt might happen, people do express that to people around them. And so really the people who are closest to them and see them every day, having them with some additional tools to equip them with intervening could be a really powerful thing.
What I learned so far, especially today with our training earlier, is it's better to say something than to not say something. It can really, really make a difference in someone who is experiencing suicidal thoughts or just in a really dark place, or just experienced trauma or whatever may have you, that it is okay to not be okay. But we have to do our part in engaging in those conversations and being able to get to a place where we're comfortable approaching somebody. And it may not be someone we actually know or have a close relationship with. It could be somebody we just met or somebody that's passing by, but you can see the signs and they appear to be sad or whatever they may be experiencing. Sometimes it's better to, if you feel it in your heart, in your spirit, I feel that you should have that conversation, or you should just make a person feel like they matter and that they belong here.
It kind of goes off of that, like, one act of kindness can like change someone's whole entire mindset. So it's like that one question of asking them like, how are you feeling, opposed to like, how are you, could change that individual's mindset, because now they don't feel as if they are in this dark space. You know, you never know that you could be like that little bit of shimmering light for them to change those suicidal ideations and, you know, making a plan opposed to like not making a plan. So
I agree. How are you feeling is very different than how are you.
Yes.
It's so easy to say, oh, well, I'm good. And I mean, it's just a quick response. How are you feeling? Or what's something new that you've been getting into? You know, just engaging a little bit more and going into a little bit more detail, I feel is important as well.
Instead of just being polite, like, how are you? Like, how are you feeling is opening up more of a door for someone to really just kind of like feed you their mind and what's going on with them.
So I hear in both of what you're saying is really instilling hope and using that connection to be able to create space for someone who might be struggling to get deeper into that, because, you know, life is very fast paced and we may miss things, and it's okay to also go back and check in on someone. We have a lot of means to communicate, so luckily that's sometimes good and bad. But I'm curious, you know, as we're talking in your sharing how you've connected with people in your lives, and what support would you offer someone who is nervous about going into a conversation about suicide with someone they love?
If you don't feel like you can do it, that's okay. Then you need to find someone that can do that. I'm not saying hold an intervention, because then that individual is going to feel like they're under attack and they'll close themselves off even more. But it's important that the question does get asked, because you don't want something to occur, something tragic to occur, whereas now you're beating yourself up with the I shoulda, coulda, would've. So that's something that's in that training, that it's just like the question has to be asked, and it's important that it gets asked. And then there are some ways that, you know, in the training it shows like, here are some like direct ways to do it, or here's like a softer approach, and those might not work for anyone. You know, like in that training it has specific language, but what does that look like when you're actually talking to a friend or a family member? You're not going to use like these clinical ways of having that conversation, but being able to probably lead up to it, I think, is also important. You know, sometimes it may be difficult to just start right off with that, like a suicide question, and ask them if like, hey, like, are you contemplating, like, or do you have suicidal ideations? Sometimes you just have to build up to that, because you know, vulnerability is something that many of us don't want to expose ourselves to, because we have our own experiences of being vulnerable, whereas you were not validated in your vulnerability. So I think that's something we also need to take into account for.
Yeah, I agree. The approach could be different, and it depends on the relationship that you have with the individual that you're speaking to or you're thinking about approaching. And I agree with Tynisha when she says you want it to be natural and you don't want it to come off as an assumption, because the last thing that we want is a person who may be experiencing suicidal thoughts to think, oh, well, now they're on to me, or they're feeling even more attacked. They already may be experiencing loneliness and feeling like they have no one to turn to. So choosing our approach and how we engage in that conversation is very important. And I think the best way that we can do that is, me personally, if I feel it in my heart or I'm thinking about somebody and they come to my mind, I reach out. I send that text message, I make that phone call, I extend that invite to go to lunch, dinner, or just to go out and get outside and just engage and participate in the activity.
Yeah, the both of you had touched base on, like, we have so many other means of communication that just to ask the question, it doesn't necessarily mean that you have to pull up to their crib and say, like, hey, like, what's going on? You know, if you see something on social media, you can DM them. If you have their phone number, you could text them, you can call them, because sometimes that might be even like the door kind of opening, if it's like through like a text message or something of that nature, because when sometimes you're confronted with it, they might backpedal even more.
Yeah, so you're really talking about the importance of connecting with that person, understanding what their needs are, and reaching out in unique ways so they don't feel alone. You know, there's a lot of stigma around suicide, and people who are thinking about it may feel isolated and alone. And so I think really understanding that starting a conversation about suicide will not put that thought into someone's mind. It's really about normalizing it, as I think many people experience it, especially when there's a lot of stressors and loss happening. So thank you for kind of talking about that. I think everyone has their own path to figure out how do I talk about and think about suicide, and then how do I connect with others. And so we're really encouraging everyone to join a training. We have our website, which is chicago.gov/suicide prevention, which we'll talk about a little bit later around resources. But there's a training section that has open free trainings in different communities that we will be continuing to build on. So that was just part of our launch, was 8 trainings to start with, but you can request a training, join one of the trainings that are up there, and we'll be continuing to post them. I can shift our conversation a little bit to the data. I think the data has been an interesting piece to this initiative, in that we have access to a lot of data in the health department. There are national trends that we see, and we see high suicide rates among white men, but we also know that there's a lot of nuances and suicide disparities that are unique to Chicago, but also ones that we want to pay attention to with different populations. So a recent study shows that Black and Latinx Chicagoans are dying by suicide earlier than white and Asian groups across the city. We also see that suicide rates increased 12% among Asian females, 9% among Black females, 19% among Black females, and 24% among Latino males. And then we also see very high rates of suicide among youth, and contemplation or thinking about suicide among trans, non-binary, and other gender minority adults who are seriously considering attempting suicide. So we see a lot of disparities, and we can break down the data in another day, but we're really looking to triage supports and tailor our supports for communities who experience marginalization and who are disproportionately impacted. So I'm curious to hear your thoughts about suicide data and how we work with that in our initiative.
Yeah, so the numbers are too high all across the board. Being a Black woman and hearing that data, not only amongst the Black women, but the Black men as well, it's not talked about enough, and especially in the Black and brown skin community, it's kind of overlooked and it's not taken seriously. And so we need to do our part and come together and get to the point where we can get that number down to 0, especially with our youth and our babies, we need to hold on to them, and we need to have those conversations, and we need to be able to be there for them in a way that many of us may not have experienced when we were young. We need to be able to touch them in a special way and touch each other in a special way where we can help uplift all communities.
Yeah, not to desensitize the data in any way, because it is very alarming, but it's also unfortunately not surprising to hear that these numbers are rising, especially going through the pandemic where many of us were just isolated. And then, the world opening back up, it has been a very difficult transition for many of us to lean on community because there's so much that has gone on. There's been so much loss. The way of the world and just America in a sense, like this uptick in just racist activities, like it's very alarming to see, someone that looks like you get shot on camera. Now it's on social media and it's just over and over and over and over again where is getting desensitized. Like that was this trend, right, of DEI and making sure that everyone feels inclusive, and now we're at a point where it's getting outlawed in Florida, so seeing this uptick, like we have to understand like these root causes. And me being a Black woman, you can see like these different racist infrastructures that are implemented throughout the city, throughout just America in itself, and us not doing what needs to be done in the sense of like making sure that these systems are changed and that they remain to be changed in the senses that it may not impact me right now, but it'll impact my kin, for us to continue like the good fight in that sense. And making sure that we continue to check up on one another because it takes a village. It really, really does. Making sure that you're checking up on the strong friend, the person that's always supportive, that they need to be supported too. When someone's like, I'm okay, dig a little bit deeper, be a little bit more persistent with that. It's just truly, truly sad to see all that. And I also question, even with those numbers as high as they are, is it still possibly underreported? Because as you said, like it's very high amongst Caucasian males. And from the trainings and the things that we've done, we were able to see like the choice that people have made when they wanted to unalive themselves. And it's like, people always hear like, oh, they took a gun and they shot themselves or something of that nature. But then you're also seeing, these overdoses that are also high within the Black and brown community as well. So even though that is considered a death by overdose, are we also seeing that, is it possible that was their way of suicide and making that choice? So that it is just truly, truly just sad. And being able to be a part of this first cohort and going out into the community, starting from May. And then I know like one of our last trainings that we have right now is in September. And I know that we have this opportunity to make this larger than it is so that we're able to cover all of Chicago, that every person, like that we're able to hit every single community so that folks have this opportunity to learn more about this and be able to have more of these conversations where it's not just like you're shut off in your room and you're isolated, that there are people out there, whether friends, family, or just community members that are here and willing to help and want to be a social change agent and wanting to decrease these numbers.
Mm-hmm. Yeah, thank you both for speaking to the data. It's difficult to sit with and to start to break down how we can move forward and address it. And a lot of times I use the point of intervention? Where do we start to intervene? And so, with the Suicide Prevention Initiative, this is just the platform that CDPH now has created. So we want to be as collaborative as possible with those doing work around suicide prevention in the city to learn from and to build on, to leverage these efforts across the city. And one community member who engaged in a training said, I'm glad you didn't focus too much on the data, because I learned skills that I can take with me to really connect with my loved ones. And so I think it's about balancing all the different pieces that prevention entails, large-scale public health prevention measures. And so we're really learning as we go, and invite people to connect with us, to sign up for a training, to request a training, and to talk to us about the work that you're doing as well. The last piece I want to make sure we don't miss is referrals. We really want to open up conversation and supports. However, there are many crisis resources in the city of Chicago. Sometimes they're not the easiest to navigate. And so I think another piece is really getting to that place with people we love around help seeking, and helping them get to professional care. And so I mentioned the website. We do have a section around mental health resources, specifically for how to develop preparedness around crisis resources. What resources are out there? You can call 988. What is connected to 911, and what do you need to do if there's a mental health crisis where 911 is needed? There are walk-in options, hotlines that are tailored to different populations, as well as kind of a directory of ways to see what mobile crisis teams are in the city. So I encourage the audience to look at that outside of this training, outside of a crisis, just so you're prepared in how to navigate the landscape. But as we wrap up, I just want to ask both of you kind of your thoughts about help seeking and getting people connected to professional care, and how we can do that effectively. So we can start with Colleen.
Of course. So seeking help for suicide, first and foremost, again, it's okay to not be okay. And a lot of the times, if we're someone or we know someone who is experiencing suicidal thoughts, that person could feel embarrassed to ask for help. They could feel embarrassed to ask a loved one or ask that friend, will you go with me? I've been experiencing this. And so we as QPR instructors, or even as individuals, we have to be able to extend that hand to be there for that person and to go get help with them. Can I go with you? Can I go with you to get help? Will you let me go with you to get help? Or how can I support you during this time? What do you need from me? So first we also have to know who we are asking, or who we are approaching, and who we're asking if they need that help, if they need that support. So that's important to know as well.
Mm-hmm. Thank you. Yeah, that is, I think the process of walking with someone figuratively, right? But being able to take them through that process so that they don't have to think too much about how they're getting there, but they're getting there. Yeah. Tynisha, thoughts?
I liked how you touched base a lot on being that support for that individual, and still having them have that control of whether they want to seek the help or not, and emphasizing like it is okay to not be okay, because many of us feel like when we're not okay, we just can't be around anyone, where it's like you don't want to be that burden or something of that nature. And like that next step of being able to get that help, if that's the choice that you make, I want to go past the referral and just letting people know that when you do make that choice to seek a therapist, the first one may not always work. And that is okay. That doesn't mean there's something wrong with you, like, or there's something wrong with that person. It's just like that just doesn't work. And don't stop because that first person is not working when you're seeking that assistance. There are other clinicians that are out there. There's free support groups. I think that's also really important to say too. Like, maybe you don't want that one-on-one, maybe you need to be in a support group as well, to seek that, to be able to get that type of help.
Mm-hmm. Yeah, thank you both for speaking to that and you know, the process of getting help and what your supports mean in that. And so, you know, I really appreciate the conversation today around this. We really want to encourage people, if there is immediate crisis in play, to contact 988 or 911. I recommend often to just practice chatting or calling 988 if you have a moment, just to see what it's like for yourself, because that will help you be able to work with someone else who might need that support. So there are different ways to prepare, as well as to join us in this initiative with your ideas and to join a training. And we will continue to build this this movement and to keep shining the light on the topic of suicide. So thank you so much for being here, and we really appreciate all of our listeners.
And that's our show. Thanks for joining us today. Don't forget to rate and subscribe wherever you find podcasts. I'm Dr. Bora, and we'll see you next time.